Good day friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about a case of cerebellar encephalocele in a young patient who is around 18 weeks of gestation. And you can see that this is the fetal skull, and in the posterior part of the fetal skull you find that the calvarium is absent. There is a bony defect over here and there is a mass or the cyst hanging behind the posterior part, that is in the occipital region. And you can see that the density of this skin or the tissue of the cyst is much lesser than the density of the bone. So this is not the bone which has been shifted outward, but this is the bony defect in the occipital part of the brain, and it is nothing but the cerebellar encephalocele. If I try to see the things in detail, I find that this is the thalamus, which is normal, in the third ventricle over here, but the fourth ventricle and the cerebellum cannot be seen. It means the cerebellum along with the meninges have herniated through the cyst into the neck of the patient. To show you the cerebellar encephalocele in the sagittal section of the entire body, and you can see that this is the cerebellar encephalocele which is hanging in the neck, and this is the spine. Fortunately, there was no spina bifida or the open spine defect in this patient. This is the lateral ventricle posterior horn, and it appears to be normal in size. This is the heart which is beating normally, and there were no associated congenital heart defects. The stomach bubble could be seen normally. These are both the lower limbs, and you can see and appreciate the active movements of the lower limbs. This is the triple vessel cord. This is the coronal section of the face, and you can see both the orbits, upper limbs, and the other facial structure which appear to be symmetrical. And from here it appears that the bones will be normal, but once we tilt the probe, we find to see in the occipital region, we find that there is occipital encephalocele. Showing the same thing in the gray scale, you can find there is a big cyst at the posterior part of the brain in the occipital region, that is the cerebellar encephalocele. There is no polyhydramnios in this patient. The AFI was normal. The clip showing the attachment of the umbilical cord to the abdomen of the fetus. There is no omphalocele. The encephaloceles are not uncommon, and they are most commonly seen in the occipital region, and the incidence is around 1 in 4,000 cases, and they can be associated with the Arnold Chiari malformation or the Dandy-Walker syndrome or the Michael-Gruber syndrome. I will not go into the details over here, but this is a reasonably good case of cerebellar encephalocele. In case you like our video, please do subscribe to our channel. Do not forget to press the like button and share the video among large number of friends. Thank you very much.